Magandang araw po sa ating lahat. This is our first video on our everyday drill, rationalization, and the common questions na possible na lalabas sa board exam. Sana po ay mapanood ninyo. Masaya po ako na gumagawa ng mga ganitong videos para po sa ating lahat. Okay? So, simulan na natin agad. For a patient with Addisonian crisis, it would be dangerous to administer A. epinephrine hydrochloride, B. fludrocortisone, C. potassium chloride, and letter D. hydrocortisone. Ang sagot po natin dito is letter C. potassium chloride. Administering potassium chloride in Addisonian crisis can worsen hyperkalemia, leading to cardiac arrest, respiratory failure, and muscle weakness. Ang problema kasi sa Addisonian crisis, there is insufficiency of cortisol and aldosterone. If there is insufficiency of aldosterone, may hirapang ma-eliminate ang potassium. Again, if there is insufficiency of aldosterone, may hirapang ma-eliminate ang potassium. At kung there is problem in the elimination of potassium at binigyan mo pa ng potassium hydrochloride, mas lalong maiipon ang potassium sa katawan, worsening hyperkalemia. Safe option po yung epinephrine hydrochloride because it helps manage hypotension and shock. And as well with fludrocortisone, safe din po kasi it replaces the mineralocorticoids. Okay? And also hydrocortisone, it is not contraindicated kasi it helps in replacing the glucocorticoids. Okay? Basta ang sagot natin dito, it is dangerous to administer potassium chloride in Addisonian crisis because it can worsen hyperkalemia. Number 2. The parasympathetic nervous system affects all of these organs by A. Increasing the heart rate, B. Dilates the pupillary smooth muscles, letter C. Increasing gastric motility, and letter D. Promotes gluconeogenesis. Ang sagot po natin dito is letter C. Increasing gastric motility because parasympathetic stimulation enhances digestive processes. Yung ibang option, sympathetic nervous system po. Okay? Sympathetic nervous system or fight or flight. Bronchodilation, pupil dilation, decreased salivation, tachycardia, increased blood pressure, increased blood glucose, slow GI motility, relaxed bladder in uterus, and sweating. Shout out. Kung gusto ninyong matutunan yung kanta, I will drop the link po. This is my original composition for the sympathetic nervous system. Okay, ang sagot natin dito is letter C, increasing gastric motility for parasympathetic nervous system. Okay. Number 3. Which of the following events characterize the general adaptation syndrome stage of alarm? Stage of alarm. A. Fight or flight response is activated. B. The person regains homeostasis. Letter C. Adaptive mechanism fall. And letter D. Levels of resistance are increased. Our answer here is letter A. Fight or flight response is activated. This option accurately describes the general adaptation syndrome stage of alarm. And it is characterized by activation of the hypothalamic pituitary adrenal axis. There is release of stress hormones like the cortisol and adrenaline. And dito, there is increased heart rate, blood pressure, and respiratory rate. Yan po ang stage of alarm sa general adaptation syndrome. Yung letter B, the person regains homeostasis, hindi na siya stage of alarm, kundi resistance stage na po. Okay? Yung letter C naman, adaptive mechanisms fail. Stage of alarm ba yan? Yes or no? No. Kasi exhaustion stage na po. Okay, yung letter D naman, levels of resistance are increased. Obviously, resistance stage din po. Basta ang sagot natin dito for the general adaptation syndrome stage of alarm is fight or flight response activation. Number 4. A 6-year-old child has a low-grade fever due to viral respiratory infection. The choice of medication to reduce the temperature is A. Acetyl salicylic acid, B. Acetaminophen, letter C. Ibuprofen, and letter D. Mefenamic acid. Our answer here is letter B, acetaminophen, Tylenol, because it is recommended for children due to its safety profile. Okay? It is effective in reducing fever and relieving symptoms. It also has low risk of adverse effects compared to other options. Kasi yung aspirin, it is contraindicated in children under 18 due to risk for Reyes syndrome. Sa letter C, ibuprofen, it is not recommended for children under 6 years without consulting a pediatrician. Sa letter D naman, mefenamic acid is not recommended for children due to potential renal toxicity. Therefore, our answer here na pinaka-safe is letter B, acetaminophen, Tylenol. Number 5, the best instruction when doing abdominal assessment is, again, the best instruction when doing abdominal assessment is A, flat on bed with straightened legs auscultating first in the left lower quadrant, B, flat on bed and doing palpation first at the right lower quadrant, and letter C, flat on bed with knees slightly flexed auscultating first in the right lower quadrant, And letter D, same position, auscultating first the right lower quadrant. Ang sagot po natin dito is letter C, flat on bed with knees slightly flexed, auscultating first in the right lower quadrant. Again, flat on bed with knees slightly flexed, auscultating first in the right lower quadrant. This position relaxes abdominal muscles, reduces discomfort, and enhances auscultation sounds. Okay? Yung rationale natin dito, auscultation first because listening before palpation or percussion prevents altering bowel sounds. So, very common po yan. And bakit sa right lower quadrant? Kasi this is the starting point of auscultation as bowel sounds are typically most audible. Again, typically, mas naririnig po sa right lower quadrant. Okay? And also, knees slightly flexed. This is because it reduces tension on abdominal muscles. Again, our answer here is letter C, flat on bed with knees slightly flexed, auscultating first the right lower quadrant when you are doing abdominal assessment. Number 6, the client is on NPO since midnight. In preparation for a blood test, adrenocortical response is activated. Which of the following is unexpected response? Again, the client is on NPO since midnight. In preparation for blood test, adrenocortical response is activated. Which of the following is unexpected response? A, low BP, B, oliguria, C, warm flush, dry skin, and letter D, low serum sodium levels. Our answer here is letter C, warm, flush, dry skin. Why? The adrenocortical response, specifically the release of cortisol and aldosterone, helps the body to respond to stress. Example is yung fasting sa question. And the expected responses include increased blood sugar levels, increased blood pressure, fluid retention, electrolyte balance maintenance, at yung sagot natin na warm, flushed, dry skin. This is due to corticol's effect on blood vessels and sweat glands. Mali po yung low BP kasi cortisol and aldosterone increase blood pressure. Mali din po yung oliguria because aldosterone promotes fluid retention, reducing urine output. And also mali din yung low serum sodium levels kasi aldosterone regulates electrolytes, maintaining sodium levels. Basta ang sagot natin dito is letter C, warm, flush, dry skin. Ikaw ba naman yung hindi kumain? Diba? Number 7, as PTH levels increase, calcium level in the blood is A, increase, B, decrease, letter C, stay the same, and letter D, none of the above. Again, as parathyroid hormone levels increase, calcium level in the blood will increase. Letter A po ang ating sagot. Parathyroid hormone stimulates calcium release from bones. Parathyroid hormone enhances calcium absorption from the intestine, and parathyroid hormone increases renal calcium reabsorption. That is why nag-i-increase ang calcium level in the blood. Okay? Again, as parathyroid hormone levels increases, the calcium level in the blood will increase also. Number 8, as hypernatremia or increase in sodium in blood progresses, BP will? Again, as hypernatremia progresses, BP will increase. Ang sagot po natin dito is letter A, increase. Because hypernatremia leads to fluid shifts causing blood vessels to constrict. Constricted blood vessels increase peripheral resistance, and increased peripheral resistance elevates blood pressure. Again, as hypernatremia progresses, BP will increase because hypernatremia leads to fluid shifts causing blood vessels to constrict. Constricted blood vessels increase peripheral resistance, and increased peripheral resistance elevates blood pressure. Okay? As hypernatremia progresses, BP will increase. Number 9, as thyroid hormone levels increase, pituitary thyroid stimulating hormone secretion will? Our answer here is letter B, decreases. Again, as thyroid hormone levels increase, pituitary thyroid stimulating hormone secretion decreases. Our answer here is letter B. The reason behind here, thyroid stimulating hormone regulates thyroid hormone production. High thyroid hormone levels will signal the pituitary gland to reduce thyroid stimulating hormone secretion. This is a negative feedback loop that maintains hormonal balance. Okay? Next question, number 10. Following head trauma, the client complains of hearing ringing noises. The nurse recognizes that these assessment noises suggest injury to the A, frontal lobe, B, occipital lobe, C, 6th cranial nerve, and letter D, 8th cranial nerve. Our answer here is letter D, 8th cranial nerve. The 8th cranial nerve, or the auditory or vestibulocochlear nerve, regulates hearing and balance. Thus, tinnitus or ringing noises indicates damage to this nerve or its pathways. Basta ang sagot natin dito is letter D. Number 11. The extraocular muscles of eyes are controlled by which of the following cranial nerves? Our answer here is letter C. number 3, number 4, and number 6, or the oculomotor, trochlear, and abducens. Hindi po kasali ang optic because it only transmits visual information and not with the movement of extraocular muscles. Okay, number 12. The component of plasma responsible for maintaining the osmotic pressure of blood is A. Plasmin, B. Albumin, C. Fibrinogen, and letter D. Gamma globulin. Very common question. Our answer here is albumin. Albumin produced by the liver maintains blood osmotic pressure, preventing fluid shifts from blood vessels to tissues. Okay. I think this is the last item, and thank you so much for watching. See you tomorrow.